Welcome to this model. In this model, we're going to be talking about care plan. Care plan is a document that helps you to arrange all your activities. It helps you to arrange all the aspects of the patient's care according to timeline. All right. So care plan shows the procedure and the time. So 8 a.m. to 8:15, you have to do this. 8:15 to 8:30, you have to do this. 9 a.m. to this time. So care plan is a document that helps you organize every aspect of the patient's care according to timeline. So you don't come to work and you're like, Mr. Morris, so what are we doing today? What do you feel like doing? Do you want to go for a walk? Okay, let's go for a walk. Do you want to eat? Okay, let's eat. No, you already have a care plan that has been drafted and has been carefully, created, for you to work with. But before you create a care plan, you need to go and do what is called assessment. You need to go and assess a home. So for example, you walk into a care home and you're asking for a caregiver. You say, I need somebody to care for my father. My father is 70 years old. I need one of your caregivers to go care for him. And because he's a man, you're like, oh, who is there? Gabriel, please come and follow them and go care for Mr. Morris. You cannot do that. So when the request comes to the care home, you have to first of all go to the house. You want to go and assess the house. You need to find out everything about Mr. Morris before you assign. So you assess before you assign. You assess before you assign, because during your assessment, you might find out that Mr. Morris doesn't even want a female caregiver. So imagine if you had assigned a female caregiver and he doesn't want that. So when you go for assessment, what do? First of all, you need to take the personal data of the client. You want to know his name, his age, his height, his weight, his gender, languages spoken, religion, educational background, religion. You want to have his data. So the first thing you take is his personal data. Then the second is his medical history. What exactly is the issue medically with Mr. Morris? Is he okay? Is he diabetic? Is he hypertensive? Can I see the doctor's report? You want to study, because most times they'll just say he's fine. He just needs somebody to stay with him. No, you want to look at the medical report to know for sure what exactly are the health challenges or the health concerns of your clients that you're about to take on. Then the third will be surgical history. You need to know what surgeries has he had recently, because if you don't ask for his surgical history, remember, ambulation, minimal and maximal transfer, you might be lifting him where he just had a surgery, and that can cause a serious injury. So before you assign somebody to care for him, you want to know the surgical history. Then you also want to find out, number 4, his limitations. What can he do by himself? What can he not do by himself? Okay, so sometimes they'll tell you things like, oh, daddy doesn't like anybody cooking for him. He can cook his food. He might just need you to help him, wash some vegetables here and there. But you need to find out what are his limitations. What is he able to do by himself? What is he not able to do by himself? What, those are like his limitations. Then finally, you want to assess the home. That is the point. You have to go around. Is everything okay? Go into the bathroom. Is the place well lighted? We mentioned a lot of things before performing bathing as a procedure. Is the place well lighted? If you notice that the bulbs in the house are not bright enough, you have to tell them all these bulbs needs to be changed before a caregiver resumes here. If there's a broken staircase, broken rail, something that is not right, do they have a call bell? If their father has a high blood pressure, they need to buy a Spig for you to work with. Everything you need before you resume there needs to be in that home. Then once you are done with assessing of the home, that is when you now sit down and draft what is called a care plan. So because he is diabetic, you must add the fact that you will check his blood pressure whenever you come to work. Because he's hypertensive, you want to include checking blood pressure whenever you come to work. So you draft a care plan. So whenever you come to work or a caregiver comes to work, they follow that plan. You don't go out of the plan. All right. So a care plan, just like it appears on the screen right here, it's activity, procedure with time. Activity by the side with time. So you come, first of all, what you want to do is maybe get on your work clothes. Remember, we said you cannot wear your work clothes in public areas when you come to work. So the first thing could be you get on your work clothes. The next thing would be you want to go and take over from the person that worked the shift before you. So after takeover, the next thing you might want to do is check vital signs on the care plan. After vital signs can be something like oral care. That's brushing of teeth. After oral care, you want to bathe and groom. After bathing and grooming, you want to clean the environment. After cleaning the environment, breakfast. After breakfast, medication, morning medication. After morning medication, you want companionship. You want him to sit out and receive fresh air. So it just goes on and on and on and on like that until you get to the last part, which is documentation and handover. Okay, so that takes us quickly into discussing about documentation. We're going to explain the difference between observation, reporting, and documentation. Observation, reporting, and documentation. So observation is when you use all your senses. You use all your senses to identify or to notice changes in appearance, changes in behavior, changes in general well-being, changes in daily routine. So with your eyes, with your sense of sight, you look and notice that, no, Mr. Jones is looking pale. This is not Mr. Jones I know. With your eyes, you notice that his eyes are red. His urine is a bit yellowish. With your eyes, you can detect all that. With your nose, you can perceive. Yes, you're used to the way his poo smells, right? But with your nose, you can detect that something is toxic about this urine today. Okay, so with your senses, you observe. With your senses, you notice changes. With your palms or with your hands, you can feel that his skin is hot or too cold or whatever it is. So using all your senses to identify and notice changes in a client's daily routine, in a client's behavior, in a client's general well-being, that is what we call observation. Then when you observe, two things can be done. Number one is to report or to document. If it is something really serious, something that you cannot wait, his eyes are pale and you cannot find, like something really bad, you have to report. Now, what is reporting? Reporting is an immediate verbal communication of something you have noticed, and you have to report to either a supervisor or a service team leader. So observation is an immediate. If it's in the care home, you go straight to the nurse's office, you go to the doctor's office and tell them, you need to stand up, you need to come and check up Mr. Jones, there's something that is not right. An immediate verbal communication. If you're at home alone with Mr. Jones, you need to pick up your phone and tell somebody what you have observed. An immediate verbal communication of an observation taken to a service team member or a supervisor, usually in person or over the phone. But documentation is just a daily written communication of actions taken by the caregiver. So remember, we spoke about the care plan. The care plan is what you're supposed to do. So it says 9 a.m. you bathe. You ended up bathing by 9:05. You have to document that you bathed by 9:05. Everything you do, you must write it down. Writing down your daily is a daily written communication. Written down is called documentation. Immediate verbal reporting is called reporting. When you now identify and notice changes, is called observation. Now, everything that you report should be documented, but not everything documented should be reported. I'm going to say that again. Everything you report should be documented, but not everything documented should be reported. And anything not documented is considered not done. Anything not documented is considered not done. So let's assume, for instance, there's a particular medication you're supposed to give to Mr. Morris before you leave the house, and you know you gave that medication, but you just forgot to write it down that you gave the medication. And something happens. By the next morning, Mr. Jones has been rushed to the hospital, and they look at the documentation sheet, and they're like, this happened because you didn't give Mr. Morris the medication. And you're like, no, I gave him. I'm sure I gave it to him, but as long as you didn't document it, you didn't do it. So anything not documented is considered not done. So you need to learn and never forget to put in writing every single thing you did. Now, care plan is what you are supposed to do. Documentation is what you finally did. Sometimes, not all times, will the care plan align with your documentation, because Mr. Morris might receive a visitor. If receiving a visitor is not in the care plan, but it happened. So you didn't feed him by 3 p.m. because he had a visitor. You must document that. Everything not documented is considered not done. The care plan is what you are supposed to do. Documentation is what you finally did. I am super sure you've gotten value from this module, and I look forward to seeing you next. Bye for now.